Okay, here are the antiarrhythmic drugs. Very complicated, lots of information. Let's see how fast we can get through it. Right in the center, you got the cardiac action potential. The black is the normal, and we've got the color coordinated with all the different classes of the antiarrhythmics. See what does what. We've got on this side, the left-hand side, is the class 1 or sodium channel blockers, class 2 beta blockers, class 3 the potassium blockers, class 4 the calcium channel blockers, and class 5 which would be digitalis and adenosine. So let's start over here on the left hand side and go through the different classes of the one class A. They're all sodium channel blockers, but sodium class 1A, they actually slow down that depolarization, and what they do is they bind to open sodium channels which are inactivated. And you've got two pyramids, so you've got dipyramide, you've got a big p-cane or procainamide, and you've got a skinny quinidine. Okay, these are used for arrhythmias. It lengthens that cardiac action potential. A lot of the toxicities you can actually cause torsade point, and the treatment here is magnesium. So if that happens, you can throw that on there. But quinidine has its own toxicities: anorexia, hypersensitivity, thrombocytopenia, synchism. It's part of the P450 group. Procainamide can cause lupus, so you have to discontinue the drug. You go down to the class 1B, and there's a little story that goes along with that. Lido, the Mexican Chihuahua, toking cocaine and tossing, and has funny toes. And so the funny toes are the phenytoin, which I didn't put on there, but it's not used as often anymore. So you got lidocaine, is because that's his name, Lido, and you got the Mexican Chihuahua, Mexitine, and toke cocaine or tocanide. Okay, what you get, you can get with tocanide is granulocytosis. With lidocaine, you get confusion or CNS difficulties. You can get some pulmonary fibrosis. It's used for ventricular arrhythmias. This yellowish is what is it's a shortened action potential. 1Cs, still sodium channel blocker. Oh, forgot 1B is phase 3 repolarization. Class 1C also slows that phase depolarization. Now this happens where this is propagates fleas. So propanophone and flecainide, anyway, propagates fleas. So think flea and propagates. And this right here has less of a slope. It doesn't change the action potential, just a less of a slope. It's using last choice in life-threatening arrhythmias. And we can move on to the beta blockers. So over here we have the beta blockers. What do? They block them. We have the TIM is carrying propane and PIN, so it's TIM, propanolol, and PIN. These are the non-selective beta blockers. The selective one, beta 1 blocker, Cafe. It's where ACE, 8, Eskimo meet. So I mean, those are the ones that are more selective to beta 1. Ace-butylol, esmolol, and atenolol. It's used for some supraventricular arrhythmias, AFib and A-flutter. But you've got some toxicities. You've got heart failure, asthma, and you can't use it with asthma, and be careful with diabetes. Over here you've got the class 3 drugs. Go back up to the beta blockers. They increase or suppress phase 4 of depolarization. So if you remember that, suppress 4. Now here in the class 3s, they prolong phase 3. Bring it 3. And what you've got here is that Brett tosses the pigs while I butt 'em, shoot 'em, and Amy dares them. So Brett, like Brett Favre, see the 4 on his jersey? There you go. Brett tossylate, Brettilium tossylate. I butt 'em, I butylide, and shoot or sotalol, and Amy dares amiodarone. Okay, so the class 3. These are potassium channel blockers. That's by pigs. Pigs are the potassium. They're used for VFib, tachycardia. Move down to class 4. These are calcium channel blockers, and you've got that cafe again with verapamil and dill. So you got dill and vinegar, verapamil and diltiazem. It squishes the AP, shortens the AP conduction. It's used for angina and supraventricular arrhythmias. You can get hypertension, and it's not suggested when you've got Wolff Parkinson White disease, and not used with beta blockers. Kind of forgot the toxicities in 3. So hypertension here, a lot of toxicities with amiodarone. You've got pulmonary fibrosis and thyroid problems, and if you see that, it takes that action potential really wide. So now we jump back down here. Oh, finished with those. Let's go over to the class 5 drugs. Digitalis, it's Dizialis, and of course the yellow goggles, because that's a side effect. You get yellow vision. A lot of arrhythmia problems you can't use with antibiotics. Adenosine is like aid, like a band-aid, adenosine. You get dyspnea, flushing, hypertension with that. These are all of the antiarrhythmic drugs. I'm going to go into a little more detail on some specific treatments, but if you can keep them straight in what they do and how they work, it'll help out a lot.